Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a fascinating and important piece of veterinary research focused on a challenging condition affecting our canine companions, meningoencephalitis of unknown origin, often referred to as MUO. This condition isn't a single disease, but rather a group of non-infectious inflammatory diseases that target the central nervous system in dogs. As the name suggests, the exact cause of this inflammation remains unknown, which makes diagnosis and predicting how a dog will fare particularly difficult. While previous studies have looked at individual factors that might influence survival, a comprehensive understanding of prognosis in dogs with MUO has been elusive. This brings us to the study we're exploring today, a retrospective analysis of a large group of dogs diagnosed with presumptive MUO. Researchers at the University of Liverpool and the Royal Veterinary College in the United Kingdom joined forces to identify clinical factors that could help predict survival, the likelihood of the disease returning, known as clinical relapse, and the chances of long-term disability in these affected dogs. Their work involved carefully reviewing the medical records of 447 dogs diagnosed with MUO across 2 referral hospitals. To be included in the study, the dogs had to show clinical signs pointing towards inflammation within the brain. They also needed to be older than 6 months. Furthermore, these dogs had specific findings on magnetic resonance imaging of the brain, often showing multiple areas of increased signal intensity, combined with an increased number of mononuclear cells in their cerebrospinal fluid, the fluid surrounding the brain and spinal cord. In some instances, dogs with brain imaging strongly suggestive of MUO but showing signs of increased pressure within the skull, where collecting cerebrospinal fluid might be risky, were also included even if a fluid sample wasn't obtained. Dogs were excluded if their cerebrospinal fluid analysis was normal, if their follow-up period was less than 6 months unless they died during that time, or if their owners chose euthanasia without attempting treatment. The researchers meticulously gathered a wealth of information from these medical records. This included details about the dog's age, breed, sex, and whether they were neutered. They also looked at how the clinical signs started, whether suddenly, gradually, or over a longer period, as well as how long these signs were present before diagnosis, and how they progressed. The specific neurological problems observed during the initial examination were also recorded, helping to pinpoint which areas of the nervous system were affected. Importantly, a neurodisability scale, or NDS, was retrospectively assigned to each dog based on these initial neurological findings. This scale is a tool designed to quantify the severity of neurological deficits in dogs. The study also noted the results of cerebrospinal fluid analysis, including the total number of cells and the protein concentration. Finally, the initial and long-term treatments that the dogs received were documented. The goal of this extensive data collection was to identify patterns and associations between these factors and the eventual outcomes for the dogs. Now, let's move on to what the study revealed. Of the 447 dogs in the study, a significant majority, 82%, survived to be discharged from the hospital. Looking further out, at 6 months after diagnosis, just over 63% of the dogs were still alive. However, it's important to note that among those who were alive at 6 months, 36% still had persistent neurological deficits. The median time that the researchers followed up with the dogs was 11 months, ranging from as short as 1 month to as long as 24 months. During the course of treatment, a little over half, 50.6%, of the 316 dogs with detailed follow-up information experienced a relapse of their clinical signs. The average time until a relapse occurred was 7 months, with a range of 2 to 15 months. Interestingly, the researchers found that dogs who still had neurological problems 6 months after their diagnosis, as well as those with higher scores on the neurodisability scale, and those whose clinical signs had been present for a longer time before diagnosis, were more likely to experience a relapse. Now, I'll hand things over to delve deeper into the specific risk factors identified in this important research.
Building on what we've just heard, the researchers conducted a thorough statistical analysis to pinpoint which factors present at the time of diagnosis were most strongly linked to a dog's outcome. When they looked at survival up to 6 months after diagnosis, several factors stood out as having a negative impact. Specifically, the study found that certain breeds, most notably pugs, were less likely to survive to the 6-month mark. Additionally, the presence of epileptic seizures at the time a dog was presented to the veterinary hospital was significantly associated with a decreased chance of survival. Furthermore, dogs that exhibited paresis, meaning muscle weakness, at presentation also had a lower likelihood of surviving to 6 months. Finally, the neurodisability scale score at the initial examination proved to be a crucial indicator. Higher scores reflecting more severe neurological impairment were negatively associated with survival. The researchers also investigated factors associated with the risk of clinical relapse, the return of neurological signs after initial improvement. Their analysis revealed that dogs who did not have a complete resolution of their clinical signs within the first 6 months after diagnosis were significantly more likely to experience a relapse. Similar to the survival findings, a higher score on the neurodisability scale at the time of diagnosis was also associated with an increased risk of relapse. Perhaps surprisingly, the length of time that the clinical signs were present before the dog was diagnosed also played a role. A duration of more than 7 days before presentation was linked to a higher risk of relapse. The neurodisability scale, which we mentioned earlier, emerged as a particularly valuable tool in this study. The researchers found a significant difference in the initial NDS scores between dogs who went on to have permanent neurological deficits and those who made a full recovery. Moreover, the NDS score at presentation was not only linked to survival and relapse but also to whether a dog would have persistent neurological problems. The study determined that the NDS score had acceptable accuracy in predicting survival at 6 months, with a specific cutoff score of 7 suggesting a higher risk of death. This highlights the potential of the NDS as a practical clinical assessment tool for dogs with MUO. In their discussion of these findings, the researchers noted that the 6-month survival rate observed in their large study was consistent with previously reported survival rates in dogs with MUO. The finding that approximately half of the dogs who survived to discharge experienced a relapse also aligns with earlier research. The association between seizures at presentation and decreased survival echoes previous studies, possibly reflecting a more severe form of the disease or owner decisions regarding euthanasia due to the challenges of managing seizures. The identification of paresis as a negative prognostic factor for survival is a novel finding in the context of canine MUO, but it mirrors observations in human patients with multiple sclerosis, a disease with some similarities to MUO. This suggests that motor deficits might indicate more extensive or persistent damage to the nervous system. The increased risk of mortality in pugs compared to other breeds in the study supports the known predisposition of this breed to necrotizing meningoencephalitis, a severe subtype of MUO. While other breeds are also susceptible to necrotizing forms of MUO, the particularly poor outcome in pugs might be linked to breed-specific factors, such as the potential fragility of certain brain cells. The study underscores the importance of the neurodisability scale as a clinical tool for initial assessment and prognostication in dogs with MUO. The association of higher NDS scores with poorer outcomes across the board, survival, relapse, and persistent deficits, suggests that this scale can help clinicians identify dogs at higher risk. Just as in human multiple sclerosis where higher disability scores at the start of the disease predict worse long-term outcomes, a higher NDS score in dogs with MUO should prompt increased vigilance, more frequent monitoring, and consideration of more aggressive treatment strategies. The researchers acknowledged several limitations to their study. The retrospective nature of the data collection means they relied on existing records, and the neurodisability scale was not applied prospectively in all cases. The lack of definitive histopathological confirmation in all dogs means that misdiagnosis remains a possibility. Additionally, the diagnosis of relapse was primarily based on the recurrence of clinical signs, with fewer cases having repeat advanced imaging or cerebrospinal fluid analysis. Finally, the study spanned several years, during which treatment protocols and standards of care may have evolved. Despite these limitations, the study provides valuable insights into the factors influencing the prognosis of MUO in dogs, reflecting real-world clinical practice. The researchers emphasize that while corticosteroids remain the cornerstone of treatment, the lack of standardized treatment protocols makes it challenging to definitively assess the impact of specific therapies. They conclude that the identified risk factors can help guide monitoring and decision-making in managing this debilitating disease, suggesting that dogs with these risk factors might benefit from more intensive monitoring or different treatment approaches. Further prospective studies are needed to validate these findings and explore the potential for improved outcomes through risk-stratified management strategies. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.